Hello, I'm Glenn Mendoza from BSB HR3L. Now we are going to discuss about addressing the financial burdens of illness or injury. A group health plan is sold collectively to an entire group of people rather than to individuals. The medical care plan offered by many companies is an example of a group plan. Each of the three types of losses resulting from illness or injury can be addressed in multiple ways. Of course, you can pay all of your own expenses. Number one is covering your direct medical care costs. Direct medical care costs are the type of costs most commonly cited in the oncological literature. Direct medical cost involves a transactions for medical services, including such things as physician services, the diagnostic tests, and the hospitalization expenses. Number two is covering your rehabilitative and custodial care costs. Custodial care is a non-medical care provided to assist people with daily living. Custodial care services may include waiting, cooking, cleaning, and other necessary functions. Number three is covering your lost income. Make the following your money habits in managing health expenses. Number one is always maintain coverage for direct healthcare expenses. Number two, when changing employers, consider continuing your medical care plan coverage using rights established through the COBRA law. COBRA law. COBRA law is a Consolidated Omnibus Budget Reconciliations Act or COBRA. It is a health insurance program that allows eligible employees and their dependents that continued benefits or health insurance coverage when an employee loses their job or experiences a reductions of work hours. Number three is working people should sign up for an employer-sponsored premium conversion plan and a flexible spending account of healthcare spending when available to save money on taxes. Number four, if you are a frequent user of healthcare, reduce spending on deductibles or co-insurance by choosing an HMO or PPO. HMO stands for Health Maintenance Organizations, and the coverage restricts patients to a particular group of physicians called a network. PPO is a short for preferred provider organizations and allow to patients to choose any physicians they wish, either inside or outside of their network. Number five is take advantage of employer-sponsored long-term disability income insurance or consider purchasing protections individually. Number six is regularly reevaluate your need for long-term care insurance against your resources for providing such care on your own. That's all. Sources of protection from direct medical care costs. A medical care plan is a generic name for any program that pays or provides reimbursement for direct medical care expenditures. When a medical plan is available as an employee benefit, the employer typically pays the cost of the worker, and possibly other members of the worker's immediate family. For the lowest cost plan, the employer offers, employees can choose a higher price option or add family members to the coverage by paying an additional charge. New employees generally must make a choice among the available plans within the first few days of being hired. Health Maintenance Organizations. Health Maintenance Organizations or HMOs provide a broad range of healthcare services for a set monthly fee on a prepaid basis for the specific monthly fee. Health insurance provides protections against financial losses resulting from illness and injury. It may cover hospital, surgical, and other medical expenditures. Consumer-driven healthcare. Consumer-driven healthcare is a term describing an approach to medical care that is different than that typical HMOs and traditional health insurance. With these two latter approaches, consumers pay very little out of their own pocket for their medical care, and thus have little incentives. To minimize healthcare spending, the principle behind the consumer-driven healthcare is that the knowledgeable and informed patients' employees will spend their own money more carefully than they would spend an employee or health plan's funds. Therefore, consumer-driven plans require higher out-of-pocket spending by consumers so that they will shop around, compare prices, pick and choose among options, and all other things consumers normally do when making expensive purchases.
It's not easy to understand health insurance. Many people do not have access to affordable health insurance, and millions more do not have any coverage at all. The government needs to make a number of big picture reforms to make health insurance work better. Meanwhile, if you're fortunate enough to have health insurance under the current system, you may utilize it strategically to improve your health and minimize your out-of-pocket costs. Here are some questions you can ask to get the most of your health insurance plan, whether you're choosing a plan for the first time or considering switching. First, what types of care are covered? Getting care from someone or somewhere covered by your plan saves your money. Getting care elsewhere, on the other hand, may result in your health plan paying less, leaving you with higher expenditures. That's why you should inquire about the sorts of care covered and double check that the doctors and clinics you intend to visit are included in the health insurance plan you're considering. There's more to health insurance than numbers, medical care, and drug coverage. There are frequently additional advantages and bonuses that can significantly enhance your health or save your money. Will you, for example, have access to health coaches? Will you be eligible for a discount on your gym membership or at the supermarket? Are there any virtual clinic visits that are free of charge? If you look into the possibilities, you can find some pleasant surprises. Questions to consider. Is there anything unique about this plan that other plans don't? Well, I take advantage of these extra benefits. Which ones are important to me? Second, ask who is covered by your medical benefits. Consider the following scenario. You get sick and need to go to the hospital for a few days. Your partner prescription list expands. The kids break a few bones at practice on top of suffering dengue in the rainy season, and so on. It's difficult to predict when situations like this may arise, so make sure your plan makes care cheap if you need it. Finally, you'll want to strike a fair balance between spending those that you can anticipate and those you can't, especially if it impacts not only you but also your family. Lastly, ask when the coverage will start and end. You can prepare for an emergency appendectomy, but you can be clever about when you schedule your scheduled checks and operation. As a result, knowing when your health benefits begin and expect is critical if you want to get the most out of them. Health insurance plans have deductible amount, which is the amount of money you must pay before your medical expenses are fully covered by your insurer. Your deductible reset to zero on January 1 of each year, which means you'll have to pay for medical care out of pocket until you hit that barrier. care out of pocket until you hit that barrier. Oh my god. There are a couple of ways to approach scheduling a major medical surgery so that you may maximize your health care coverage. Some people will put off getting a major treatment until they've met their deductible. If you don't have a lot of money saved up, this can make sense. If you pay into your deductible with healthcare services throughout the year and the scheduled surgery after you breach it, your insurance is more likely to cover the majority of the cost and you won't have to pay a large out-of-pocket expense. In the end, health insurance plans aren't one size fits all. As a result, you must speak with someone who can assist you in matching your specific needs with the appropriate plan for you.
Hi, this is Girly Mauri, presenting Planning for Long-Term Care. Many healthcare episodes include a period of time when the patient is no longer needs skilled medical care but does need assistance to a degree that requires confinement in a nursing home or a special at home. Factors to assess when considering a long-term policy. The degree of impairment for benefits to begin. Activity such as difficulty of seeing, hearing, walking, or problem solving. The level of care covered by may be primary, secondary, or tertiary. The person's age. The benefit amount. The waiting period, and lastly, inflation protection. Protecting your income during disability. A number of resources are available for income protection during period of disability. Disability income insurances replace a portion of the income lost when you cannot work because of illness or injury. Although it is probably the most overlooked type of insurance, it is the vitality important for all workers. In the Philippines, both GSIS and SSS members can avail disability pension proven that the required papers are provided.